All right, to the news now. Tonight, we are marking a tough milestone in the pandemic. 15 million deaths connected to the coronavirus. The World Health Organization estimates includes people who died directly because of the virus or because it overwhelmed healthcare systems. It's more than double the official death toll of 6 million.
And the U.S. is having its own sobering moment, now reaching 1 million people who have died with the virus. That's according to an NBC News analysis. And the pandemic is far from over. In many parts of the country, COVID hospitalization numbers are rising. That is the case in Maine. Tonight, the number of people in the hospital with the virus is more than double what it was in mid-April.
NECN's Dustin Bukowski takes a look at how that can happen in a state where close to 80% of people are vaccinated.
According to New York Times coronavirus tracking data, Maine, as of Thursday afternoon, is tied with Rhode Island for state with the highest number of COVID-19 cases per 100,000 people in the country. Specifically, 53 cases per 100,000 residents, a 144% jump for Maine in the past 2 weeks. It's just behind Delaware at the top of the list for hospitalizations per 100,000 people, too.
We believe that this is following a similar pattern that we've seen before, where Europe gets these surges first, and then New England and the Mid-Atlantic gets them.
Dr. Dora Ann Mills, Chief Health Improvement Officer for Maine Health, one of the state's largest healthcare networks, says the jump is not attributable to an undetected version of COVID.
This is so far all attributable to variants and subvariants we already know about, correct?
Yes, they appear to be subvariants of Omicron.
Asked about the high case rate, a spokesperson for Maine CDC replied that the agency suggests taking a longer-term perspective in terms of case and hospitalization rate change, noting those rates fluctuate more radically for states with smaller populations. Maine had a nationwide low transmission rate last week. In terms of precautions people can take given the case jump on the tracker, the spokesperson pointed us to U.S. CDC COVID prevention steps based on transmission. On Thursday afternoon, only one county in Maine met the federal threshold recommending someone wear a mask indoors. 4 other counties were in a category recommending those at high risk for severe illness talk to a healthcare provider about masking or other precautions. Dr. Mills recommends looking at the U.S. CDC case map while planning a trip as well if you're traveling to a state with higher COVID rates from one with lower rates.
Make sure to get your up to date on your vaccinations, use ventilation, and take some test kits along. Similar to just looking at the weather forecasts and dressing appropriately.
Looking ahead, Mills expects the jump in New England and the Mid-Atlantic could move across the country. She says families with children under 5 who can't get vaccinated or elderly people with chronic illnesses, even if they are vaccinated, may want to take extra precautions. That said, she feels better overall about this recent spike than the winter Omicron surge. Boosters, antiviral pills, and high-quality masks are even more prevalent now.
We've got all these tools.
In Portland, Dustin Bukowski, NECN.